Your blood sugar is controlled. Your cholesterol is down. Your blood pressure is within range. By every number your doctor is looking at, your medication is working. And yet, you feel worse than you did before you started, more tired, less sharp, a low-level fog that does not lift, pins and needles in your hands or feet, a sense that something has shifted inside you that no appointment has been able to name. And when you mention this, you are told, your numbers look great. Keep taking the medication. I want to explain why this happens, why controlled numbers and a deteriorating body are not a contradiction, why they are in fact a predictable consequence of a gap in how most medications are prescribed. There are 3 reasons why people feel worse on medications that are medically working. I am going to walk you through all 3, with the evidence, the mechanism, and the specific action that begins to close each gap. Let me start with something that took me years to fully articulate. Modern medicine is extraordinarily good at measuring targets: HbA1c, LDL cholesterol, systolic blood pressure. These are precise, reproducible, evidence-based numbers. And when a drug moves them in the right direction, we call the drug successful. But here's what those numbers do not measure. They do not measure how you feel. They do not measure the nutrients being quietly depleted by the drug. They do not measure the downstream consequences of what the drug is doing to biological systems that are not on the standard panel. A medication can lower your blood sugar while simultaneously depleting a vitamin your nervous system depends on. A medication can protect your heart from a cardiac event while reducing the molecule your muscles need to move. Both statements can be true at exactly the same time. The number is going in the right direction. The person is getting worse. This is not a failure of the medication. It is a failure to account for what the medication is doing beyond the single target it was designed for. Reason number 1, metformin and vitamin B12. Metformin is the most widely prescribed oral medication for type 2 diabetes. It is also one of the most effective. The evidence for its cardiovascular protective effects is substantial. But metformin has been consistently associated across studies conducted in the United States, Netherlands, Portugal, Saudi Arabia, Japan, Nigeria, and South Africa with depletion of vitamin B12. A 2024 review published in Touch Endocrinology, examining 21 peer-reviewed studies published from 2015 onward, found a significant association between metformin use and reduced B12 levels in 17 of those 21 studies. The estimated prevalence of B12 deficiency in metformin users ranges from 4% to as high as 41% across global populations. How does it happen? Metformin's molecular structure alters the surface charge of cell membranes in ways that interfere with calcium-dependent processes. Calcium is required for the absorption of vitamin B12 from your small intestine. When that process is disrupted, B12 absorption falls, not to 0, but meaningfully, progressively, over time. And the consequences of B12 deficiency are not subtle. B12 is required for myelin, the protective sheath around your nerve fibers. Without adequate B12, that sheath degrades, and nerve degradation produces a very specific pattern of symptoms: tingling or numbness in the hands and feet, difficulty with balance and walking, memory gaps, slowed thinking, mental fog, fatigue that sleep cannot touch, mood changes, low mood, irritability, anxiety that seems sourceless. And here is the detail that makes this clinically urgent. A 2025 paper published in a peer-reviewed psychiatry journal documented a case of a 60-year-old woman on long-term metformin who presented with cognitive impairment so significant it was initially assessed as early dementia. It was not dementia, it was metformin-induced B12 deficiency, and when her B12 was restored, her cognition improved. This phenomenon has a clinical name: pseudodementia, a condition that looks on examination like dementia, but is caused by a correctable nutritional deficiency. The Standards of Care in Diabetes 2025 edition, the authoritative annual guideline published by the American Diabetes Association, now specifically emphasizes the importance of monitoring B12 in metformin patients, particularly those on doses exceeding 1,500 milligrams per day or those who have been on the medication for more than a year. And in June 2022, the UK's Medicines and Healthcare Products Regulatory Agency, the MHRA, issued a formal advisory stating that low B12 is now considered a recognized common side effect of metformin. Not a rare side effect, a common one. If you take metformin, ask your doctor specifically about B12 monitoring. not just serum B12. Ask about active B12 or methylmalonic acid testing, which provides a more sensitive indicator of functional B12 deficiency. For food, clams are the richest dietary source of B12 on the planet. A 3-ounce serving provides over 80 micrograms, far exceeding the daily requirement. Beef liver, salmon, sardines, eggs, and dairy are all meaningful contributors. Now, reason number 2. And this one affects an even larger number of people, because it is caused by a medication that almost nobody suspects. Reason number 2. Proton pump inhibitors, PPIs, Omeprazole, Lansoprazole, Esomeprazole, the acid reflux medications. They are among the most prescribed drugs in the world. They are highly effective at what they do, and the vast majority of people who take them have no idea what they are doing to their body's ability to absorb nutrients. Your stomach acid does not just digest food, it prepares nutrients for absorption. Vitamin B12 cannot be released from food without stomach acid. The process requires pepsin, an enzyme activated by stomach acid, to cleave B12 from the proteins it is bound to in food. Without that cleavage, B12 passes through you largely unabsorbed. Magnesium requires an acidic environment for absorption through the gut wall. Iron requires stomach acid to be converted into the form your intestine can absorb. Calcium absorption is reduced in low-acid conditions. A 2025 systematic review published in Curious examining long-term PPI use in older adults on Polypharmacy found a 12 to 18% reduction in serum vitamin B12 over 12 months of continuous PPI use. And B12 deficiency was documented in up to 20% of long-term PPI users. A separate 2025 retrospective cross-sectional study published in the FOSSEB journal confirmed that chronic acid blockade reduces absorption of vitamin B12, magnesium, calcium, and iron, all 4, in patients taking PPIs for 6 months or longer. Now here is the compounding problem. Many people with type 2 diabetes also have acid reflux. Many people with hypertension also have acid reflux. They take Metformin for their diabetes. They take a PPI for their reflux. And those 2 drugs, taken together every morning, deplete B12 simultaneously from 2 different angles. Metformin blocks its absorption from the small intestine. The PPI blocks its release from food before it even gets there. I want to tell you about a patient I will call Irene, 67 years old, type 2 diabetes, acid reflux, mild hypertension, 3 medications every morning, Metformin, Omeprazole, a blood pressure pill. Her GP described her as well controlled. Excellent. Reflux, managed. Blood pressure, stable. Irene described herself differently. She said, I feel like I am slowly disappearing. Not dramatically, not all at once. But piece by piece, over 3 years of well-controlled numbers, the person she recognized as herself was fading. Her thinking was slower. Her hands tingled at night. She had stopped following the thread of conversations the way she used to. She had been referred to a neurologist who found no structural abnormality. The word mild cognitive impairment had been mentioned. Nobody had checked her B12. When we finally tested her active B12 and her methylmalonic acid, 2 tests that give a functional rather than a surface-level picture, her B12 status was significantly depleted despite a borderline normal serum result. We adjusted her diet, added B12-rich foods. Her specialist agreed to B12 supplementation in the methylcobalamin form, which is more bioavailable than the standard cyanocobalamin. 6 months later, Irene told me she had started following conversations again. The tingling had stopped. She described it like this. It is as if a window that had fogged up gradually over 3 years had been quietly cleaned. She was not cured, not transformed, but she was back. Reason number 3, the compounding effect of multiple medications. We have talked about individual medications and individual depletions, but most people over 60 take more than 1 medication. According to CDC data, nearly half of all American adults take at least 1 prescription drug. Among adults 65 and over, the majority take 5 or more, and each medication in that combination may be depleting a different nutrient. Each depletion is assessed, when it is assessed at all, in isolation. But your body does not experience these depletions in isolation. It experiences them simultaneously. Magnesium from the diuretic, CoQ10 from the statin, B12 from the metformin and the PPI. None of those depletions on its own reaches the threshold for concern. Each one on paper looks borderline at worst. But together, in one body, across 1 year, they represent a systematic degradation of the nutrient foundation that every biological process depends on. This is not speculative. This is the predictable arithmetic of what happens when we treat each drug as an independent intervention in a body where nothing operates independently. And the symptoms that result from this compounding depletion, fatigue, brain fog, muscle weakness, poor sleep, low mood, are precisely the symptoms most commonly attributed to aging. Not medication, aging. And when you accept that framing, when you believe your deterioration is inevitable rather than addressable, you stop asking questions that have answers. Let me give you the framework for what to do with everything I have just told you. Step 1. List every medication you take, not just your main prescription, everyone. Step 2. For each medication, identify its known nutrient depletions. This series has covered the most common ones: statins, CoQ10, diuretics, magnesium, potassium, zinc, ACE inhibitors, zinc, beta blockers, metformin, PPIs, B12, magnesium, calcium, iron. Step 3. Request the right tests. Red blood cell magnesium, not serum. Active B12 or methylmalonic acid, not serum B12 alone. Ferritin, not just serum iron. CoQ10 plasma levels if statin-associated muscle symptoms are present. Step 4. Build the conversation. You take this medication. You understand it is working for the target it was prescribed for. You want to ensure the nutritional consequences are being monitored. That is a complete, specific, reasonable conversation. It is not confrontational. It is the conversation that keeps you whole while the medication does the job it was prescribed to do. Irene stopped disappearing. Your numbers being good is not the same as you being well. And now you have the language to demand both. One final thing before you go. We have now covered the most common drug nutrient depletions across this series: statins, diuretics, ACE inhibitors, beta blockers, metformin, and PPIs. In my next video, I am stepping away from medication entirely and focusing on something different. There is a rhythm inside your body that controls when you sleep, when your hormones peak, when your immune system is strongest, and when your brain clears itself of the waste products that accumulate throughout the day. It is called your circadian rhythm. And research published in 2024 and 2025 has made it increasingly clear that disruption of this rhythm, even mild, chronic disruption of the kind that comes from irregular sleep, late eating, and insufficient morning light, is one of the most significant and most overlooked drivers of brain aging in people over 60. The next video covers exactly how to repair it, without a prescription, without a supplement, with 3 changes to your daily routine that your circadian biology will respond to within days. Subscribe. Hit the notification bell. I will see you there.